Subscribe now for health tips in simple language. Dr. Madam, imagine that you are 45 years old, busy with office work all day. You don't have the energy you used to have. Fat is accumulating around your stomach. Walking in the morning has now stopped just by will. One day, a health checkup suddenly revealed that the blood sugar level was very high. This is the story of a simple office worker named Suman. This is how type 2 diabetes starts, silently, slowly, without any sound. Today, we will learn how type 2 diabetes occurs, what exactly happens inside the body, and how our daily habits are the main cause of this disease. This information has been written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK Medicine and Hormone Specialist. So let's get started. There is one important hormone in our body, insulin, which is produced by the pancreas. Its job is to transport sugar or glucose from the blood into the cells so that the body can get energy. But in type 2 diabetes, two major problems arise. First, insulin resistance means that the body's cells no longer respond properly to insulin. As a result, blood sugar cannot enter the cells. Second, insulin production decreases. The pancreas gradually becomes tired and cannot produce enough insulin. As a result, sugar accumulates in the blood. But the body's cells become weak due to lack of energy. Now let's see what are the main reasons for this. These are largely related to our lifestyle. That is, they are under our own control. One is being overweight or accumulating belly fat. When excess fat accumulates in the body, especially in the belly, the cells become resistant to insulin. About 90% of people with type 2 diabetes are overweight. Even people who are at a healthy weight but have a large waistline are at increased risk. Lack of physical activity, such as walking or exercising, causes more blood sugar to be used for energy. But if you sit in the office all day or lead a sedentary lifestyle, your blood sugar levels will gradually increase. Regular walking, cycling, and even housework can reduce the risk. 3. Eating too much sugar and refined foods, white rice, bread, sweet soft drinks. These cause a sudden increase in blood sugar. They make the pancreas work overtime. As a result, insulin becomes exhausted. Just by eliminating soft drinks, the risk of diabetes is greatly reduced. 4. Oily, fatty, and fried foods. The fat in things like ghee, butter, fast food, and packaged snacks can interfere with the function of insulin. Instead, use good fats like those found in fish, nuts, mustard oil, or olive oil. 5. Lack of sleep and mental stress. When you don't get enough sleep, a hormone called cortisol increases in your body, which raises blood sugar. Constant stress has the same effect. People who sleep less than 6 hours a day are more likely to have high blood sugar. 6. Smoking and excessive alcohol. These further increase insulin resistance. With excessive alcohol consumption, the liver releases even more sugar into the blood. Now let's talk about the internal causes, or biological factors. For those whose parents or siblings have diabetes, the risk is 2 to 6 times higher. The risk also increases with age, usually after 40. South Asian, African, or Hispanic populations have a higher risk of this disease even at a lower weight. Among women having polycystic ovary syndrome or PCOS also increases the risk. And if the pancreas is damaged, for example, from pancreatitis or after surgery, insulin production also decreases. Certain medications can also be a cause, such as long-term steroid use, some birth control pills, or seizure medications. For example, someone taking steroids for arthritis for months on end might find their blood sugar slowly rising without even realizing it. Environmental factors in modern life also play a big role. Pollution, processed foods, and sitting all day. All of these combined create oxidative stress in the body, which further increases insulin resistance. The whole process is like a vicious cycle. Insulin stops working effectively. The pancreas produces more insulin. Eventually, it gets tired. The sugar level rises, and slowly, prediabetes turns into full-blown diabetes. Suman's story is actually everyone's story. Diabetes doesn't appear suddenly. it builds up slowly year after year. But the good news is that with the right lifestyle, weight control, walking, good sleep, and regular checkups, it can be prevented. So remember, control your weight, walk a little every day, sleep well, reduce stress, and get your blood sugar checked regularly. Because timely awareness and a change in habits are what can keep this disease at bay. This information was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, a medicine and hormone specialist. The information has been taken from renowned sources, the Mayo Clinic, Cleveland Clinic, NIDDK, Diabetes UK, and Medscape. If you like this video, please subscribe to the Dr. Madam channel and share it with others, so more people can learn about health in simple language.